Okay, so we've got the queue to start. So good morning and welcome everybody to our breakout room, right? Where we'll be covering healthcare. All right. Of course, with HSBC and with EY moving through a lot of the ESG, sustainability, and health, as well as sustainability in terms of healthcare. This continues to be a strong topic that we do need to cover, right? And I would love to hear from our panel today. We have Wan Nadia, who is the CEO of the Thomson Hospital Kota Damansara Group, right? As well as LG, Mr. LG, who is CEO of Zulik Pharma. All right, and I think it's a good mix. We've got on one side from Wan Nadia side, a lot of the healthcare, right? Frontliners, right? Actual operational changes that's happening in healthcare. And then from LG side, it's a lot more on how we're managing the whole supply chain, especially with vaccine requirements rolling out, right? Making sure that we're getting the right deliveries and also getting the right supply in the world today, right? So maybe just to set the scene, of course, with the response to COVID-19, the pandemic has and continues to stretch the healthcare system. Sadly, India looks to be going through another big tsunami, right? It's also beyond a wave already. Unfortunately, even for some of my colleagues in EY, they have been suffering through it, either personally or through their family members. So I think the call to be vigilant continues to be there, right? The need to continue to do a lot more with less continues to be there, and the threat of healthcare systems and supply chains that will be stretched to its limit continues to be there. So that's what we are basically faced with, right, on the immediate basis. But I thought I also expand that thinking, right? Is this really the new norm, right? That we might never actually come out of a pandemic situation for some time. So how do we prepare ourselves mentally, as well as the speakers here today? How are we preparing our healthcare systems, right? Our healthcare supply chain to make sure that it is, expanded and able to go through the entire end-to-end process. Yeah, maybe I just give a minute or two to our key speakers for a quick introduction. Wan Nadia.
Yeah. Hi, good morning, everyone. Please call me Nadia. I'm the CEO of Thomson Hospital Kota Damansara and also the Group CEO and Executive Director for TMC Life Sciences Berhad, which is the holding company for the hospital, and a few other businesses that we run, including IVF clinics under the TMC Fertility brand, TCM Medicine under Thomson TCM, as well as TMC Care Retail Pharmacy. So happy to answer all your questions about what we've been going through over the past year and a half with the COVID pandemic.
Okay, good, thank you. And LG?
Good morning, everyone. My name is Louis-Georges Lassonnery, but easier to call me LG. I'm the Chief Executive of Zulik Pharma in Malaysia and Brunei. As a background, I'm a pharmacist, by the way. Zulik Pharma, Malaysia and Brunei, we are not known by all consumers and patients, but by healthcare providers like Nadia, hospitals and doctors. We are importing and distributing all over East, West, Malaysia and Brunei, pharmaceuticals, vaccine, diagnostics, medical device. And basically, to give a number, we are representing 50% of the pharma market in Malaysia and the majority of vaccines.
Okay, thank you, LG and Nadia. So let's get started. So first question is open to both panelists, right? And please feel free to chip in whenever. So all of us have been working through the pandemic this last year, and all our businesses have changed, and the way that we interact with our clients and how we operate has all changed. But of course, being in healthcare, both of you would probably be in the thick and probably the largest change, right? Given the impact that COVID has had on you all. So maybe you can just help to describe to us, right? How has your business and processes changed during this pandemic? And do you see these changes actually, as I said, to be the new norm, right? It is going to be permanent. It will probably never go back to how it was before. You just imagine telling our children, previously it was like this, and they won't believe us, right? Television had no color, right? And does it mean minimizing face-to-face, right? Does it mean a supply chain that's a lot tighter rather than the one that we were going through, globalization and spreading out capability? And especially from LG, I would love to hear the whole idea of manufacturing of vaccines, right? What is really the way that we need to move forward? And what's the views of the supply chain and the resiliency built into the supply chain? Okay, over to you all.
Okay, thanks for giving me the floor. I would first of all say that I think it's more than a year now, and 1 year ago, most of us at least didn't know what would happen and how long it will last. And we are all thinking it will be a crisis. And by end of last year, this would have finished. Now that we have more than a year of history behind us, we know that it's still going to last for some time, at least this year. And we know that most of the adaptations we have been going through for hospitals or supply chain like Zulig, most of the adaptation we have been going through in order to be able to continue to distribute and offer treatment to patients are here to stay almost permanently, or coming and going back, being on and off, asking us to be very flexible to adapt to the situation. And we know well in Malaysia, like in every country, one day it feels good, one day it feels bad. The number of COVID cases are fluctuating a lot. So speaking about supply chain, I think we, like many industries, we adapted very quickly 1 year ago. For sure, everything which is physical, a lot of our job is physical. It's moving boxes, treating documents, taking orders, sending invoices. So a lot is physical. What is physical had to remain physical, doing warehousing and distributing a product. So the main changes we have done there and which are staying and will remain, it's making our people safe and ensuring the continuity. So changing our warehouse has changed also the jobs which are more customer services, administration, commercial. These, like in many industries, we have been able to move online. So it was just between brackets, buying equipment for our teams, training our teams to manage remotely their staff. That maybe will come back to physical presence at the office, as everybody is missing physical relation. I mean, working is also a place where you build relation, you have social life. So I believe this will come back to office, but probably will be on and off, and where they can work. So it's overall, my conclusion will be the changes we have adapted to since last year are here to stay, at least for this year.
Okay, thanks, LG. And over to you, Nadia.
Concrete one. Now, the WHO has confirmed what we have all known for many, many months now, that COVID is actually an airborne disease. And therefore, the design of our buildings and ventilation in our facilities became something of a primary concern. And very early on, we had to make a lot of adaptations to the building and engineering systems to ensure the safety for our patients and customers. Installing extractor fans, HEPA filters, UV sanitizers, but not all of them are the same. So a lot of engineering considerations have actually gone into, and now discussions with architects on how to proceed and make buildings, commercial buildings, safer for a large group of people. I think that is something that a lot of people are going to have conversations on. The second one is on the type of services that healthcare providers will be focusing on. Infectious disease traditionally has been somewhat left behind or a little bit overlooked as people were looking at higher trends of non-communicable diseases. But then I think now with the pandemic, infectious diseases are back in the spotlight. There is a focus now on molecular diagnostics, genetic sequencing, all these kind of services that are very important for us to identify and detect viruses and also detect variants, which will become a concern. Because we know that this virus eventually will become endemic in the population. The third one, of course, in healthcare, nobody has ever explored that concept before, and it was quite a struggle to suddenly move everything online. And also things like telehealth will definitely be here to stay. This issue of reducing crowds, distancing, I think will become something that is normal, and therefore systems for us to manage flow of people through our buildings, appointments, bookings, teleconsultations, those will become very important and here to stay. The fourth part, I think, is payments and contractual obligations. So as we know, before, pandemics were an exclusion clause in many of our contracts, including insurance and payer contracts. And that this really came to the fore when it came to the issue of who was going to pay for COVID treatment, particularly in private organizations or private hospitals. Yeah. And this is something that I think that the regulators will definitely be wanting to look into as we become unfortunately more susceptible to different viruses that will become global pandemics, and how would these contractual obligations, particularly I think for financing and payers, will change in that demographic. And the last one, of course, which I think LG touched on, was the diversification of supply chain. Personally, I think in Malaysia during the first lockdown in March last year, extreme constraint on PPE supplies simply because we didn't produce that many domestically. And we can see geopolitics coming into play where countries start imposing bans on exports from PPE to vaccines. It's very important for us to diversify our supply. And even for vaccination, AstraZeneca's relying on India to produce vaccines for a large part of the world, and then suddenly India is shutting down for business. What does that mean for the rest of us? So I think that it has really exposed the vulnerability in our supply chain, and countries are definitely looking at it as a matter of national security to actually shore up their own domestic capabilities in terms of manufacturing and producing some of these very important equipment and consumables for healthcare.
Yeah, okay, thanks. Very insightful, very deep. Maybe just a quick message to our participants. We will be having a 10-minute open public Q&A later. So if you've got any of your questions, I think you can start thinking through them and getting them into the chat, right? And then we can start looking at them and see whether we can surface that a bit earlier. But just before that, I think, Nadia, you raised on a good issue, right? It's about providing healthcare to, especially to our workforce today, right? So in EY, we have close to about 4,500 headcount in Malaysia alone, right? And when the issue about who is paying for testing, right? Is it covered in our insurance, right? It became something that we had to manage, right? To again balance what was best for our people, right? But what continued to make economic sense for a business. Right, so I think some of the answers could be from a digital perspective. So we found that as soon as we could pivot to a lot more digital-based solution, digital-based capability, and more importantly, how we engage our people digitally as well. Right. So maybe the question to both of you is, how have you all enabled digital transformation to happen in your organization? Right, taking into account the type of investment in technology you're making, especially as you need to respond a lot faster, right? Nowadays. Right, as well as from the people perspective, the talent, the culture, right, that you're trying now to embed, right, within your organizations. Again, Nadia, would you like to go ahead?
Oh, okay. I think from the healthcare perspective, when we talk about technology, there are a few key priorities now that we look at, especially with the pandemic. The first one is integration, data integrity, and making sure that you have enough data to actually give you a sense of what's happening on the ground. And this is happening at an institution level. It is also happening at a national and global level. So a lot of hospitals will now be looking at moving to not just electronic medical records, but also hooking them up to different sorts of systems. So even within the national vaccination effort, we have different systems that need to be integrated. Many of the issues that we are facing now with the rollout of the vaccination is, in fact, the fact that some of these systems are not integrated and that there needs to be a lot of manual work to actually transcribe and re-enter data into different systems. So having an integrated platform, a unified platform, and expectation about what kind of data needs to be submitted and managed centrally and analyze those will become really important. Coherency and data integrity. Secondly, I think it's on transparency of data in order for analysis. We are no longer looking at past trends. We are now trying to forecast and prevent future outbreaks, to look at where the hotspots will be, essentially anticipating which areas will be next to go on fire and making sure that we put safeguards there rather than waiting for the fire to erupt. So I think that in that sense, that kind of capability has become really important. And the third one, of course, when we talk about healthcare, everyone is worried about security and privacy. So cybersecurity is definitely a priority and concern for us as we move into integrating systems, as we move into the cloud, making sure that we also, the second part that you brought up, which is culture, very important for us to change the mindset of the organization and to give them the skills that they need actually to operate within this environment. So particularly, I think in healthcare, we are moving from a mindset where we are service providers to a mindset where we have to be proactive in terms of anticipating, because of the speed of change that could happen, the waves that are coming, that we need to, prospectively and preemptively take decisions to be made. And we see this in pandemic control, and will definitely become something that is an important skill for any organization in order to be able to pivot and adapt to that changes. And of course, training is really important. As we know, even in security, the weakest link is typically the human user of the system, no matter how much we invest in the technology. And therefore, I think it is time that the healthcare industry really look at its capabilities within technology and IT to make sure that we're ready to face the challenges that are coming.
Thanks, Nadia. So I hear very important, the new skill sets around data, right? Changing the culture of our own people so that they can accept digital as a way of life, right? And then most importantly, also securing it through cyber threats and all that, right? Even as we open up more, even as we try to do more digitally, we really do need to make sure that privacy of data is there, security is there, so that cyber attacks do not happen into an organization. Yeah. LG, maybe for your thoughts.
Yeah, thanks for the question. It's a huge question. Huh? I will try to be short, maybe completing what Nadia has said, which I fully agree, and it's a very good example what Nadia shared with us. Maybe two things on the magnitude of the transformation and how we are managing this transformation as an industry, as a company, and as a team. On the magnitude of the transformation, I mean, digital transformation is something which is happening all over the place in all industries, in every country since many years. But the pandemic has accelerated this. I remember already 5 years ago, with the help of HSBC, we brought online payment to our customers, pharmacies and hospitals in Malaysia. And now it's something managed as a routine. All our payments are managed online, and all reconciliation of our payment and invoices are robotized, happening automatically every night. And we started that with HSBC. Since then, we have developed an online ordering system, B2B, and now moving B2C accessible to patients. And we are integrating these systems together with telehealth systems that Nadia was referring to. Maybe a last example I would like to mention, as Nadia was talking about cybersecurity and integrity of data, safety of personal data, especially when it comes to vaccination information on patients, or security brought to patients on the product they are going to get injected in their body. We have developed, in partnering with Microsoft and Accenture, a tool called EasyVax, which is basically giving access to everyone, including patients, nurses, and doctors, to all the supply chain information on vaccines. And through simply an app on their mobile phone, they can scan the product they are going to inject or be injected, and they can know at any point of time, is this product is a real product, which should be at that time in this place, in this hospital in Malaysia. So this is giving guarantee to people they are not being injected with counterfeit or product which are just smuggled with poor warehousing condition. As you mentioned earlier before, vaccine have a very wide range of temperature control, some to -70. So you need to guarantee that the product, if it's a -70 vaccine, which is going to be injected in your body, has been maintained from production to your arm at -70. So digital transformation is really happening all over the place. And data security together with digital transformation is really crucial. I agree with Nadia. Now, when it comes to how we manage this, I mean, both in hospitals, like Thomson Hospitals, or in industry like Zulig, this is really a major change. And on one side, it's a high financial risk because we are managing many changes at the same time with huge investment. So to tackle that, we had to build, compared to years before where digital was driven by IT. Now digital is driven by IT together with operations, together with customer services, together with finance, even together with HR. Because we need to make sure we make the right decision And we need to make sure that once we made a decision, we go through it quickly because we need a return fast because we invest a lot of money. Or we need to be able as a team quickly to decide, okay, this project is failing, let's drop and let's move to another one. And this is a mindset very different from what we used to have before. Last point on how we are managing. You were talking about talents, culture, people. And Nadia was referring to that in terms of training our people to bring to them the skills they need in order to face this massive transformation. I definitely agree with all this. I will add to that we should not underestimate that digital transformation is bringing major change, not only with our relation with our clients and customers, but also within our team. And basically the purpose of digital transformation is to bring value, either through better safety, better productivity, or more traffic, or more value on traffic. So more value means also that some jobs will disappear. Some jobs with low value will disappear at the profit of new jobs, which will be created bringing more value. And from a people perspective, we as organization, together with our HR director, we have to anticipate that by engaging our team, sharing with them our vision, what digital transformation will bring to the company, what people will lose, what people may get, in order to help our team to take these opportunities. Otherwise, our people will just be victim of digital transformation. So the people piece on digital transformation is really crucial. Otherwise, we have the risk to burn our people and to burn our companies.
Good, good. So any questions from the floor? You can type it directly into the chat and then we can pick it up from there. Okay, maybe I've got one last question to our panelists, then we'll open it for the floor, right? And we're bringing it back to the whole topic around sustainability, right? And getting things through. I guess the question in health, in healthcare, especially when we deal with people, right? It's really getting it right the first time and then every time after that. Right. And with that culture, right, and with that mindset, right, and because we are dealing with lives here, right, the question about wastage, right, is really a balanced question, right? If you get it right the first time and you get it right every time, then you have very little wastage. But at the same time, to get it right the first time, right, it's a lot of investment. I think, LG, as you mentioned, right, it's a lot of investment, it's a lot of trying, right? And today with this whole culture around running things agile, right, in failing fast, right, that has really changed the concept, right, of what does it mean as wastage and what does it not mean as wastage, right? So maybe a question to both of you all, right? What practices have you all put in, right, given the need to sustain our environment as well, even in this pandemic time, right? What practices, what things have you all changed, right, in your organizations, right, to make sure that you minimize wastage, right, yet at the same time get it right the first time every time?
Maybe I can share, if you allow me, Nadia, I can share one perspective on that. And first of all, I would say definitely agree with you. Sustainability, including waste management, respecting the environment, has been taking even more importance than before, because I think all of us, including our staff and younger staff, but all of us, we have taken some distance since the beginning of this catastrophe that COVID is. And so we have learned to take care of what is really important. And so for our teams and our clients, our customers, environment is very important. And it can be sometimes very simple to be impactful. I just would like to share one project, which maybe will come to Thomson Hospital anytime soon, that we have developed with Baxter. It's a pharmaceutical company doing solutions bag for dialysis at home. We are delivering every day to something like 4,000 patients at home in Malaysia, solution bags in plastic to manage their peritoneal dialysis. And these bags used to be wasted, to be thrown to the bin. And the same at hospital, because there were no organization of how to recycle these bags. And as a logistician, it's not so complicated to do what we call reverse logistic. We distribute bags to patients and hospitals. We can also take them back because our truck will always go back to our warehouse. So we are working now with Baxter to organize this reverse logistic. And we work together with the Malaysian Business Council for Sustainable Development to, once we get these plastic bags, to recycle them in order to produce anything which can be produced with secondhand plastic materials. It's very simple, it's not very expensive, it's just a little organization, and engaging customers and patients to participate. And again, I think it's a good time now, like digital transformation, to bring ideas like this, because people are conscious about this. So I believe patients will be very keen not to throw their plastic bag in the bin and find them in the environment, but to give them back to us each time we need them.
Good, good. Nadia?
Oh, I have to admit that this pandemic has really made me think a lot about how much waste we're generating, because I think for infection control purposes, the number of single-use items and disposables has increased tremendously, many hundred times fold. Because of course, when safety comes first, it's really about not sharing of items to sort of limit the spread. But of course, the handling of medical waste has always been very highly regulated in a sense that we don't expect this waste to appear in our rivers and oceans. But we do see that there has been, for example, a lot of face mask pollution now happening in the oceans and seas. And what can we do about it? I mean, we have done very small projects. For example, when the pandemic first started, we issued, proper cloth masks to all of our staff for them to use to encourage reusable cloth masks that are 3-ply. And we also work with Yayasan Sejahtera to sell those cloth masks to our patients. We were also looking at how we could basically pay penance for our increased use of plastics by increasing our savings in other areas. So for Thomson Hospital's expansion, our new building, where we're adding another 400 beds, it will be the first hospital in Malaysia to have a green building rating, which I think is really important for sustainability. We're also looking at reducing use of plastics and paper in other areas, aside from the clinical areas, to try and make up for the increase of use in the clinical areas. But this is definitely something that we need to look into. And I totally welcome, I think, what Zulik is doing and other people would be doing in terms of recycling some of these items that we use, because we definitely use a lot of single-use items now more than before. And this is definitely something that the world, and hopefully we look forward to having more innovations in this space that would allow us to actually, reduce our carbon footprint.
Okay, thank you. Oh, looks like we have not had any questions yet. We've got a very shy crowd today here. Okay, we're I think just running out of time in the next 5 to 10 minutes. So maybe a last question to both our panelists, right? What are your big bets?
Maybe KL, if you can ask one.
Oh yeah, sure, go ahead.
So LG and Nadia, you were awesome as usual, and thanks KL. So just one quick question, and I really like the way LG when you said that people can be victim of digital transformation. So that was classic. Just one quick question. The COVID-19 definitely has put a lot of pressure on the entire healthcare sector. And are you guys seeing any accelerated change in the way ecosystem in the healthcare is behaving? And are you seeing new models around public and private partnership in healthcare?
A very good question. On the ecosystem changing, I think like in every industry, this will be driven by the final customer, which is at the end of the chain, which is patient. And although healthcare, I'm pharmacist, I'm not doctor, but we are all together with Nadia, healthcare provider, we used to be very conservative because at the end of the day, we are touching patients. So once we decide to do something, we really change our decision because we are afraid of the consequence on the patient. So by nature, we are conservative. So for years, we would have thought, okay, digital, it will come slowly in pharma, in healthcare. We see that accelerating and the push will come from patient. We have got many studies recently showing that 90% of the patients who have experienced telehealth wants to keep it no matter what. So these guys will ask to keep telehealth, and there will be a word of mouth, and this will develop. So I strongly believe what has started will continue and grow slowly because it's healthcare, but it will grow. On the PPP, public-private partnership, Nadia was referring to that at the beginning. On testing, we have seen last year that testing in Malaysia, like everywhere, has been scaling up when private companies were starting to test massively their people to keep their people safe. Because for the public government, it's too much. They cannot test everyone at any time. In every team, like in every household, we can do that. So private can help public. And we have always seen that in Southeast Asia and all over the world. You can manage good healthcare only if you call both private and public. From research to treating patients, you need public and private. It's too much only for public. I believe in vaccine, this will be the same. It's taking time because, as other speakers said, it's very sensitive. Every country wants to ensure COVID vaccine will come to everyone under good control. But sooner or later, public-private partnership will be needed. If we want every year to vaccine the whole world for COVID, again, public will not be enough. Private will have to come to help. And we know how to cooperate very nicely between government and private.
I think for us, the pandemic has shown two things. Number one, I think in healthcare, traditionally, we've been very risk averse, from the regulators down to the providers. And with COVID, I think that risk algorithm changed dramatically because something needed to be done. And we couldn't wait for regulators to have a meeting, come up with guidelines, so on and so forth. So a lot of the approach that happened during COVID was to empower the providers to provide those services first. And, regulation was sort of like regulating in the sense that if there were issues or after you've already set it up, then they would come in and sort of assess whether you'll be meeting the standards or not, which I think is a good change to have, because traditionally change has been very slow in healthcare because we are a highly regulated industry. Secondly, for public-private partnership, it's been very clear with the COVID pandemic that the Malaysian government has moved towards public-private partnership in a big way. It started with private hospitals receiving COVID patients, but with the national vaccination program, that has become very clear, where they have appointed an agency that will pay a reimbursed amount to healthcare providers to participate in the national immunization program. And if this model is successful, and I hope it is, it would set, I think, the tone and the template for expanding access to other healthcare services to the population. So I think it is a very important example and step that they're taking now during this COVID pandemic, because once they've proved it to themselves that it works, it will be a lot easier to accept and to expand that model to other areas.
Yeah, thanks, Cheryl, for that question, and thanks for the responses from our panel. I think there's another question from Rafiq, right?
Correct.
Yeah.
Can you hear me?
Yes.
Yeah. I want to change gears a little bit away from the sort of public-private space to talk about actually one of the key components within the healthcare ecosystem, which is insurance companies. What do you see, what do the panelists see as the evolution? Because I see actually that the insurance companies have been very, very slow to adopt digital transformation technologies, particularly in terms of patient acceptance at hospitals. I mean, the whole process can become instantaneous if they go real time, but there seems to be a tremendous reluctance on the part of insurance companies, particularly in Malaysia. I mean, some of the work that we're doing, for example, say with insurance companies in other countries, shows that the insurance companies are much more forward-looking in terms of changing their ecosystems to cope with the current scenario. And I just wondered what the panelists might have to say on that.
Right. Okay, thanks. So it's about the whole ecosystem being digital, right? But if one of the players are non-digital, how can you respond? What are you going to do from an overall perspective so that, again, care is given at the right time, right? Customer experience is not impacted, payments are as smooth as possible at the back. Okay.
Right. I may just tell that briefly that insurance companies, like all stakeholders in healthcare, are facing pressure from patients. And patients now, they have expanded digitalization everywhere. So they want processes digital, online, and fast, including approval of treatment, approval of reimbursement, online payment, and so on. And I cannot compare Malaysia with other countries in that respect, but I know there are several companies, private companies, coming with digital solutions to propose to, let's say, hospitals and insurance companies and patients to digitalize their process, and everyone is interested. Insurance companies are interested to attract patients, hospitals are interested in productivity, patients, they want speed and ease of use. So this is coming from everywhere. I see that coming. And some hospitals have moved to that already, and some insurance companies as well.
I think it's been a mixed bag. Definitely, I would say it's not like they're not embracing technology. Definitely, I think when it comes to claims assessment, processing, the incorporation of the use of AI and business intelligence has definitely gone from leaps and bounds. So most of the processing now is completely digital. But in terms of embracing things like telehealth, yes, I would agree that Malaysia is behind other countries. And we can see that actually payer approval for funding is very important to stimulate the growth of this service. So for example, in Canada, we see the growth of teleconsultation services, not just from patient to doctor, but also doctor to doctor, perhaps from a primary doctor to a specialist doctor. And the growth accelerated tremendously after reimbursement was approved for those services. So in Malaysia, it still remains to be seen whether the insurance companies would embrace telemedicine as a service, but definitely if we look at consumer trends, they are moving towards that with a lot of platforms offering perhaps GP or primary consults to patients online and then referring them to specialists within the hospital. So it could end up being a hybrid model, but it's also very highly dependent on whether patients can get coverage for these services. So it remains to be seen, but I'm hopeful. And I think that the government sets the right tone as well. I think that the Ministry of Health had encouraged teleconsultations very early on in the pandemic, and that actually opened the door to the acceptance by many patients to actually explore and use these services. And once that service is widely available in the public hospitals, it's only a matter of time that private sector players will actually jump in as well.
Yes, agreed. You know, there was always barriers to telehealth before this. There were barriers to a lot of things before this until the pandemic hit, then all these barriers dissolved under the digital age, right? And so I think technology has really picked up. We're using Zoom today, right? Getting 400, 500 people on a Zoom conference is no longer an issue. Infrastructure has learned to solve itself, right? So I guess maybe a closing question to both our panelists, right, is what are the big bets or the foresights that you all are making for the next 12 to 24 months, right? Given the situation that you're in now, right? And also what you think will happen in the next 1 to 2 years' time. Nadia, you want to start first?
So I think we start with the most straightforward ones. I think definitely molecular diagnostics in many of those sectors would definitely expand and grow. Sequencing, it's very important for us to get a handle of this pandemic and to be ahead of future pandemics. If we look at building domestic capacity, I think we had discussed this before for key things from PPE to vaccines. That is something that a lot of people, and we've seen companies even like Masing, who's now gone into the glove making business, and we will definitely see, I think, a trend towards this. And I hope that this sort of pandemic has been a catalyst for change in the regulatory environment in order for us to be able to adapt. And I definitely think that the regulatory landscape, not just from the Ministry of Health, but Bank Negara when it comes to insurance, payers and providers, I think the regulatory landscape will definitely have to change in order for us to adapt. And last but not least, we always talk about technology. I think if you asked us a year and a half ago whether people would accept that there would be this app that we have to scan in every single place that we go through, and it would track where we went, with whom we've been, that everybody would freak out. But that's just the reality of life today. And so how technology is going to become so embedded in tracking this data that we're producing, not just health data, our location data, and many other kinds of information in order for us to have a handle on things. And so with that also comes the security concerns and everything else. So these are a lot of big areas that I think we will see a lot of developments coming forward. And we don't want to be missing out on this, or sort of like waiting too late and then getting left out or getting overwhelmed. So I think it's important for all of us to really understand the scope and scale of these technologies. If the government chose to actually integrate all this information, it would be a very powerful tool which needs to be managed properly.
Yeah. Thanks, Nadia. And LG, any closing?
Just to complete what Nadia said, I think, yes, testing and COVID vaccination will be key. We are just at the beginning. It has to be much bigger, much stronger, much bigger scale, much faster, but it's starting. And this will have an impact not only on healthcare, but on the whole economy, how fast we'll recover. Definitely into that, both for testing and COVID vaccination, digitalization, digital tools, and public-private partnership are essential. And here I believe the government, like in every country, has a key role to play. They've already done a lot. There is still a lot to do. As Nadia said, we are a very regulated industry. I would say, curiously, in the field of digital health and public-private partnership, especially around COVID, testing, vaccination, there are still some rules to be set, and it's the government to set the tone, and then to let the market play, and all the providers, stakeholders, public-private play. And if we manage that, we can get out of the crisis quickly.
Okay. Okay, so thank you again to our panelists. Thank you for all the insights today. Thank you for the participants as well for your interesting questions or your attention throughout this time. So clearly to me, right, healthcare is at the forefront of the pandemic, right, and with sustainability as a key concept, right. I think what really came out to me today was that, you know, public-private partnership means that, you know, again, working through an entire ecosystem, right, of people providing services and receiving services from each other from there. But I think one thing that we are proud to be in Malaysia, so our strong community feel, right? And I know that if we continue to band together as a community, we will be able to get through this pandemic together. Okay, so thank you everybody. We'll be closing out the breakout room, but thanks again to the panel as well as to the participants today. Thank you. All right, bye.